Hi, my name is Jonathan Jones, and this is a video abstract for our recent paper in Developmental Science, the academic outcomes of working memory and metacognitive strategy training in children, a double-blind randomized controlled trial. And this is work carried out by myself and my colleagues at the University of Exeter, Anna Adlam, Fraser Milton, and Mostazir Mohammed. Working memory is strongly associated with other cognitive processes, and it predicts children's future academic achievement more so than IQ. Therefore, training this core cognitive capacity may benefit a myriad of related cognitive processes and behavioural outcomes. Yet recent randomised controlled trials and meta-analyses have often failed to report any benefit of training to academic achievement. And this may be because children are only learning skills and strategies in a very narrow context which they are unable to apply to other tasks. We extended upon previous training programs by incorporating a metacognitive workbook that taught children how to plan, monitor and evaluate their thoughts whilst engaged in cognitive and academic tasks. We also developed a novel control training program where children trained on an adaptive visual search task that better controlled for confounding effects of expectancy and motivation than previous studies using non-adaptive control groups. 95 typically developing children, aged 9 to 14 years, were randomised to one of three groups. One group received working memory training alone, another group received working memory and metacognitive strategy training, and the control group received adaptive visual search training. Overall, both working memory training groups showed large improvements in working memory performance compared to the control group, both immediately and 3 months after training, suggesting sustained benefits of training. In addition, the group that received metacognitive strategy training showed additional improvements in working memory performance at 3 months relative to the group that received working memory training alone. They were also the only group to show an improvement in the working memory task that was the least similar to the training tasks. Working memory training also improved children's mathematical reasoning immediately after training, but it wasn't maintained 3 months later. So this suggests that there may be some short-term academic benefit of working memory training. There was, however, no added benefit of metacognitive strategy training to maths or reading outcomes compared to working memory training alone, and this suggests that the metacognitive workbook was not really facilitating far transfer to academic outcomes. So our findings show some promise that working memory training may benefit children's mathematical reasoning in the short term when provided in addition to school. However, this needs to be replicated, and future studies should investigate whether this effect can be maintained longer term. Our metacognitive workbook was shown to increase transfer to working memory tasks, but more diverse and interactive activities may be required to promote generalizable improvements in academic outcomes.